Mission Control. You are go for lunch.
Spend some time away from your office bay to the Good Cafe. Open data, go open data, open data, go open data. We meet up virtually, our beverages are free for open data coffee. Open data, go open data, open data, go open data. Welcome to the Good Cafe. Indeed, welcome everybody. It's July 6th, a Tuesday, 2021, and it's fairly hot here in Toronto. We've got some interesting things going on today's menu. We're going to be talking about mi data, su data, and that involves some folks from the Spanish Red Cross, which we'll be introducing momentarily. I'm Keith McDonald, the barista and also the Director of Communications for Go Open Data. And our guests all the way from Madrid today, Raquel Bernedo and Cecilia Aparicio. And also, we have some local talent here. It's Amanda Bell, who is currently working with Toronto Public Health and has a background in our hospital care systems. So all three of us, four of us in total, will be talking about data and health and how it looks between, let's say, Canada and Spain. Just a reminder, too, we're taping for our YouTube channel, GoodTube, and you can see this post-event, and for those who haven't had a chance to see it live, you can see it on our GoodTube channel. And also, we're looking for questions and, of course, some answers today, so feel free to throw some questions into the Q&A pop, and I will try to get to them for you as we talk. And because it's a cafe, it's very informal and chat-like, so don't feel any pressure to ask anything you like, as if we were just talking over coffee. So that being said, let's officially introduce the folks. Raquel is actually the Disaster Management Senior Officer, again with the Spanish Red Cross. Cecilia is Acting Chief Digital Officer, and Amanda is Industrial Engineer and Quality Improvement Specialist with Toronto Public Health. So I wanted to start off actually talking a little bit about your positions, what it is that you do. So let's go to Madrid first, and we'll start with Raquel. If you can just talk about what the Senior Officer for Disaster Management does.
Okay, so what we do in the disaster management unit is that we have a huge amount of time that we dedicate to be prepared to emergencies. And then for this preparedness, we train people. We have a roster of members that are volunteers in peacetime, let's say, and they are specialized in different areas. For example, water and sanitation, hygiene promotion, psychosocial support, health, information management, etc. And then we also participate in technical working groups within the International Federation of Red Cross and Red Crescent Societies. And what we try to do is to be updated with the latest new things that can be done and that can be applied during emergencies. And once an emergency once an emergency comes, then what we do is that we respond with our teams, and we try to respond the best we know with the best people we have.
Sounds interesting, of course. And Cecilia, if you'd like to tell us what you do as acting director.
Well, I belong to the IT department, and in my current role as CTO, and together with some key people within the different action areas as Raquel and different departments, we are establishing the organization data strategy, mainly in three lines: people as the focus point, all the data governance piece, and also the data projects. And we try to increase our analytical ability to discover the facts that allow us to improve the present and future of vulnerable groups, have a more global vision that contributes to the definition of more successful strategies, show up what we didn't know or didn't see, prove what we already knew, and obviously understand what has happened, what is happening, and what may happen. This typical thing of descriptive analysis, diagnostic analysis, predictive, prescriptive, and all those things.
Wow, that's also
This is what I
interesting
do,
stuff.
what I try to do.
Fantastic. And Amanda, I'm interested in the industrial engineer part. Maybe you can clarify too how that goes with quality improvement specialists.
Absolutely, yes. So quality improvement is a very much a healthcare term, at least in North America. It's the science of measuring some of the harder to quantify things about healthcare. So that's, degrees of safety, efficiency, effectiveness, whether the care that's provided is patient-centered. And so measuring those things and then trying to implement changes to the process that will improve those things. And so while this is about 40 years old in healthcare, in the manufacturing sector where this comes from, this is about a 100-year-old practice. It comes from Toyota, from Japan, these different techniques that were put in place to massively improve the efficiency of the work that was being done.
Yeah, it sounds awesome.
As a quality improvement specialist, I'm sort of an all-purpose analyst and consultant to help people who have a measure that they want to improve.
And I'm interested from the standpoint of data and open data, how it's being used. So I know, Cecilia and Raquel, you're relatively in the early days, if that's fair to say, for your open data initiative. I'm not sure who's best to clarify just how you want to be using open data and what you've done to initialize this whole process so that Spanish Red Cross is an open data shop. Who'd like to take it?
Cecilia.
Okay. Cecilia, quite a well.
It's that we have, sometimes we have, Raquel and we have a different view of the data because we use it for different purposes. For Raquel, is something that needs to be done at this moment because she works with emergency things. And for us, it's more the day-to-day management of the whole situation and the different vulnerabilities in people. So if we, as you were saying, we have recently opened up an initiative for open data. There is available is some data that is available in our web page, and it's based on a project for the pandemic, and it's called in Spanish. It's called Responde. But it's something like we answer. It's something like that. So people ask for help and we answer. And we are providing the numbers of the things we are doing with people. For the moment, what we want with that is to provide transparency to society. So it's give them and show them what we are doing. And also, we have mainly 3 different people in the sense of the three different groups to whom we provide data to. One is society for transparency. The other is ourselves in order to improve the management of the organization. And then the third is the funders. We have funders, and we need to in order as per the accountability. So at the end, these are the main recipients, and this initiative is really for them.
Now, would you say you have a large enough team to do this, or is it really just yourself and Raquel kind of combining efforts? Have you looked towards building a team?
We are making a team. So it's a group effort, and as we move into this world, into this data world, we realize that we need more and more people, and more people involved in the different areas. For me, in my case, I'm from the IT department, but we are just a small piece of the whole machine, because people like Raquel, they are really the ones that are collecting the data, because they are they are at the front of the situations, no? So we, as an IT team, we cannot do anything without them. So we collaborate, and among all of us are trying to build the best strategy for all this.
Now, I'm wondering, Amanda, you're not part of the IT public health, right? You're separate.
No, I'm not. I'm not part of the IT, but in public health, my department is called Performance and Standards. So we're involved in defining what is the things that we're going to be measuring, or metrics of importance, not within the performance standards, not my team within the department. Surveillance, epidemiology, those sorts of things are within the performance and standards. So they do work closely together in defining what it is we need to measure, and then actually getting into the data and being able to report it and post it online.
What's interesting to me,
linked in that way.
What's interesting to me too is back in the early days, as I call it, of open data, especially in governments, it was like, who owns this? Who's going to take it? Who's going to run with it? And it usually ended up being a bit of a combination of things. In the case of, I used to work with the City of Toronto myself. It was IT and City Clerk's office that ended up owning it, if you like. So I'm wondering if you've had any issues like that. Has anybody been putting up their hands and saying, I'll take it in the Red Cross? Or did you, Cecilia, want to take it as IT?
Well, it's not that, I mean, when in any initiative or in any organization there is a starting to do data projects, and the maturity of the data is not very high at this moment. Normally everything starts with IT, because within the IT department, because we have the technology and we somehow control the technology. But it doesn't mean that we have to control everything, because we may have the technology, but the knowledge it can be outside of us. So for the moment, yes, the lead is being within IT, but it's as I said, it's a group effort, and I'm not taking decisions, so I'm not the lead of anything. It's just a group effort, and all the decisions are also taken into account within the organization strategy. So we don't make any move without the official agreement of everybody that has to be involved.
So it sounds fairly democratic, if you like. Raquel, I'm just wondering.
Has to be.
Well, doesn't it? In the end, it has to be, for sure. And even in the beginning, and actually, this is what I was going to ask Raquel. When you heard about open data and so on, what was your reaction? There could be, I guess, 3 different reactions. One is like, what? Say what? The other would be, great, we can really use this. Or the third would be kind of a neutral position. Well, what do you mean? I'm not sure, but how did you position yourselves?
Well, for me, it was more great, because I started as innovation delegate in Spanish Red Cross, and I was learning tools, mobile data collection tools, open source, to be able to use it in different countries and make this sustainable in time and resources. So for me, it has been great, and it has been an incredible journey in which I've met a lot of people involved in a lot of communities that really believe in data, in open source, and in the international cooperation side and emergencies. There are a lot of open data sets that can contribute to prepare better and to do prevention of emergencies and disasters in different areas of the world. For example, we are working with our delegations in Burundi, the Philippines, or Gambia to create risk maps. And all these maps are created because of the secondary data that is available on the different organizations, right? So for me, it's great.
The interesting thing, I suppose, about the job would be you never really know when there's going to be a crisis. And just offline before we started, we were mentioning Florida, where the condo collapsed. Can you walk us through how you get engaged. So let's just hypothesize, something like that happened. And it wouldn't necessarily be in your city, correct? It could be really anywhere that your mandate is. So what would you do? How would you marshal your forces? And how does the data aspect start? Does it get collected immediately? Is it something that's part of your process? Or is it a bit more of an afterthought? In other words, you're trying to rescue people first and then think about data? How does that go?
We try that it goes at the same time. For example, if something like that would happen here, we are activated by the local or national government, depending on the magnitude of the event. And this is because we have the role as auxiliary. We have an auxiliary role of the authorities. So we are activated, and depending on the needs, we can deploy different teams with different specialties, search and rescues, health, psychological support, etc. But at the same time, if the event is very big, we deploy like a team that is the team that is in charge of the coordination of the operation. So in order to coordinate an operation, a response in an emergency, it's very important to have the data updated, not only for being accountable with the society, but also to improve your decisions based on evidence. So this is mainly why we try. Sometimes it's difficult because not all the time it's easy to have the information in real time, let's say, but we are working towards that objective. We are trying to create new systems that allow us to have information in real time and with all the activities that we are doing. And in fact, now we are working with French Red Cross in a application that allows you to have in the map where are your teams, where are your resources, and to be able to communicate with them in order to get information real time.
That sounds really well organized, actually, to me. Would this be then, the fact is you're really not government, but you, like you mentioned, the government would request your services. So what kind of exchange might you have with the government? Do you share your data with them? How does that work?
Yes, usually what we do is that we comply with the GDPR, with the data protection regulation, general data protection regulation. And when the agreement that we have is that in every piece of paper that we collect, if we collect personal data, for example, what we advise is that this data could be could be shared with third parties, but these third parties would be local or government authorities. But this is something that we have into account and that is included in our, let's say, the forms that the people have to fulfill in order that they know their rights and how they can remove that information. So we have the data responsibility. I think that we have it quite well interiorized. I mean, I don't know if this word exists in English, but what I mean is that we really are aware of the risk that the sharing information might cause. So we are very conscious with all that.
Yeah, it's interesting too, because one of the I'm not sure what the right word is myself, but one of the things about open data is this idea of do no harm. And I can recall our clerk's office in the city at the time was certainly concerned about those kind of things. And any release that could cause harm potentially would be vetted certainly and either aggregated up so that the personal information wasn't there or just not released. So it's a case of sometimes open data isn't open because of that. So I'm wondering though, like, let's say something has happened and your team goes out. Are you involved with the actual rescue, like moving concrete and, looking for, bringing in the dogs and doing the search? Or is it more after that as people are being rescued? How does that work specifically with your group?
For example, for dogs that could help in the rescue, we only have a team in Barcelona. but they could be moved. And also the emergency military unit, they have a lot of teams that are more focused on that. We are more focused, Spanish Red Cross is more focused on the assistance of the people that has been injured. For example, with mobile health clinics or with people that can support in psychological support. We create shelters so people can rest if their homes are not available because there has been a fire or because there has been some floods, things like that. We also have a team that establish the communications, so all these different setups can be connected ones to others, and also with the coordination team. And so this is more in the line that we are responding in emergencies. But for example, when there are floods, we have been helping with our boats to be able to go into the city and try to look for people that might be inside some place and cannot go out. So we do a little of everything, but more in the assistance to the people itself.
I think it's interesting, at least from my initial perspective. It's like anything else. You have an idea what the agencies might do, and I often tend to think of Red Cross as just blood, but obviously it's much more than that.
I know.
Yeah.
In fact, here always that I say that I work at the Spanish Red Cross, people tell me, "Are you a nurse or a doctor?" And I am like, "No, I am an engineer," and most of the people get quite surprised.
Yeah, I think it's just quite interesting from the standpoint of how diverse it is. And also, I think your close proximity to other countries. You mentioned initiative with France. Tell me a little bit about just that, because you go quite far afield, don't you? I mean, you've been out of Spain, involved in disaster work as well, and you're working on some ideas of, I guess, how to manage disasters with other countries. Maybe just tell me a little bit about that.
There is once an disaster strike, there are some tools that the national society in which that disaster has happened. If they need help, they ask for help to the International Federation of Red Cross and Red Crescent Societies, and they activate the different teams around the world that can support the needs that are apparently needed. Okay. But at the same time, there is a team that is called Search Information Management Support, that there are a lot of IM people from information management people from different countries around the world. In fact, in Canada, there are a few as well, that there are a few colleagues. And all of us, what we do is that we support in emergencies with information management. We can do it remotely, and there are also some profiles that are deployed to those countries, to those emergencies, to be able to collect data. And the good thing of being such a huge network is that if something happens in Indonesia, for example, and some person in the field needs some information or some product like a map or some template for collecting data, some form or whatever, we have folks in different time zones. So at the end, when they go to bed, they send that request, and next day, probably that request has been already answered. So this is a huge network that is inside the Red Cross movement, and we try to work with humanitarian data exchange. That is an open source, is an open web page in which is a web in which you find a lot of open data information, open data sets, and a lot of information about disasters, about different assessments that have been conducted. And there is a huge network with different agencies from OCHA and UN that help and also give trainings and capabilities to different organizations, so all of us can improve in our daily work.
It's amazing, the collaboration. I mean, I say amazing because it doesn't always work that way, but it sounds very promising in terms of how you work. And I wonder, like in Canada, we're so big. So obviously there is some provincial cooperation to a degree, but I want to come back to Amanda here in that sense of with COVID, we know we did have, I think we had anyway, nurses coming in, or certainly it worked the other way around where when things were worse in another province, some of Ontario folks went. I may be wrong about that, but the idea, I think, of cooperation is absolutely necessary, and then sharing that data really too, because everybody needs the same data to work with. But having come from a hospital system as well, Amanda, when there's an emergency on, is it true that the emergencies are on alert and they could come to any particular hospital, but you're all involved in the care? Do you have any insight around that?
If there is a local emergency, so hospitals have all sorts of codes and procedures around this. You've probably seen shows where it's like code blue, someone losing consciousness or having a heart attack or something like that. Emergencies, I think consistently across Toronto are code oranges. So we have procedures where hospitals in the area of something are notified. So for example, when I was working at North York General, the van attack around North York Center Road on Yonge Street, which was an act of terrorism and killed and injured a number of people. Hospitals in the area were very quickly notified that an emergency had happened and that patients would be deployed to the surrounding area hospitals. And because North York General was one of the closest ones on site, we did have a number of patients that we knew were there and were ready for. Other codes were deployed so that the resources would be on the ground and be able to respond quickly. And so that's sort of those communication pipelines are well defined for emergencies. That one being a very acute emergency.
Now, we had talked as well just before we started about how the system works, basically, because again, healthcare gets government funding, but they're not necessarily, well, they certainly aren't managed by government. So how does that impact the operations and especially collection of data and then sharing of that data?
So it's interesting because these things have evolved over time in response to specific needs. In Ontario, there are so many legislated data disclosures to a number of different organizations that have popped up over time. So for example, for maternity-related data, there's this organization called BORN. It's a data repository of all the births in Ontario. There is another federal level institute, the Canadian Institute for Health Informatics, which hospitals are required to disclose to.
Well, we've got a slight internet glitch there, Amanda. You've frozen up. So we'll see if you come back to us. So let me just direct back to our Spanish folks. Oh, are you back? Yeah, okay, maybe it's just frozen on this screen because I see you on our live screen over here, but I'm not hearing you. Okay, Raquel, are you?
Please
yeah,
go
there
ahead.
you go. Okay, no, you're back. Yeah, and
okay.
Yeah, go ahead.
So yes, there's a number of mandatory disclosures of data and also to do with the measurement of quality, which is the work that I'm in, performance measures. So not just directly health-related data, that is, outcomes, diagnoses, the interventions. So there's also performance-related data in terms of how well the operation is functioning. So that is one of these attempts, because all hospitals are independent bodies. In Canada, we have a public payer, private provider system where the taxes pay for the healthcare, but they are privately delivered by independent organizations that are self-governing. So the Ontario government needs a way to somehow compare these disparate organizations that have disparate resources, that don't have the same levels of technology integration. And so over the last decade, there have been a lot of attempts to have hospitals disclose annually how they're performing on a number of health priorities.
It's interesting to me, related again to the communications between levels and agencies. I'm wondering, in Spain, so back to our Spanish folks, I guess the different roles that you might play in something like an emergency. So hospitals are obviously going to be involved. But you mentioned some of the social sides, I guess the psychological aspects and so on. So who decides this is a hospital matter or this is actually going to be carried by the Red Cross? How does that get determined? And again, is that something that's just routine now, that it's understood?
Yeah, the thing is that there are contingency plans and there are also agreements. And usually when we are requested is when the hospitals or the public health is overloaded. For example, if there is if there is a disaster and the hospitals or local health providers cannot provide those services, then we can be requested to participate in the response. Or imagine that there is an strike in some place and it's because it's an earthquake or something like that. There are not accessibility for other folks or other agencies to go to the place. Then if in the place is the Red Cross, then they can provide these services. But this is unlikely to happen. But yes, the thing is that we step in when the system is overloaded, or depending on the agreements that the local authorities have with the local branches.
I'm just wondering
Yes, because it's not. Sorry.
No, go ahead, please.
No, I just wanted to add that it's not only when there is an emergency, because also the Spanish Red Cross in this case, also we take care of the daily care of people. So people come to us when they need help, and they may need help maybe to hire a wheelchair because they had an accident and they cannot move, or I don't know, where they may need help with loneliness. Senior people that doesn't have anybody to talk to. I don't know, the help for refugees, for instance. So maybe some help with money problems. So they come to our local branches, and within the local branches we try to provide help in those areas. We try to cover when the government social services cannot cover those pieces, then we step in and we try to cover that piece. And not only us, there are a lot of non-profit organizations, in this case in Spain, that take care of those things. So it is another thing that we provide help with, regular things. Good.
Yeah, your work is really quite diverse. I'm not sure, Amanda, we have similar situations, but it's not really through the Red Cross, is it? It's again through different government agencies. Am I right?
Mm-hmm. Yeah, what this makes me think of is at least in the course of the pandemic, how much hospitals, which are more of a provincial entity, and then public health, which is a split provincial municipal entity, that the way that hospitals had to step up when things were not well defined, but a lot of hospitals are the ones who implemented COVID assessment clinics, the testing. They had the resources and the technological capability to start collecting data very quickly about people who had tested positive or negative for COVID, and have within their hospitals the kinds of resources. For example, Toronto Western has a tropical medicine, tropical diseases unit. And so they have the expertise, the medical expertise to tell people who test positive for COVID, here's what you have to do. So even though we had public health having a hotline and also having the procedure of calling people who tested positive, the hospitals, because they had that, because they had the scale to do this, we're also able to reach people very quickly and share that load of calling people, making sure that they self-isolated, making sure they knew the protocol for how to manage their infection.
I'm wondering too, just how busy you are. I mean, we have a awareness, obviously, in Ontario, how busy things were. But I'm curious, and also from your data collection standpoint, I'm thinking of like the fire department, right? You have the vision of them only being busy when there's a fire, and they're on shift, and maybe they're just watching TV until there's a fire, and how many fires there during a day. So do you have the data on that? Just how busy are you in a typical year? And I don't know if we can even have a typical year, but the idea that, there was so many disasters, and this is how much resources we used, etc. What's your typical year like?
Is that question for me or for?
No, it's for Spain. Yeah.
Spain.
Well, it depends a little on the year, and this last year in 2020 was a little crazy, and we try to have a dashboard together with the open data that could tell us how many people were mobilized, how many resources, how many tents did we put to support hospital in testing issues, like how many activities we were conducting, right? It depends a little on the year because we work in different areas, and it depends a little. Some of them are very small, and we don't coordinate it from the headquarters that I am based in, and other times it's bigger. For example, this year we had a big snowstorm that stopped 4 communities. So in that moment, we try to coordinate the efforts from the headquarters, but if not, it's more local. So sometimes it's difficult to know the number, but we are working in improving our systems to be able to have information on dashboards, to be able to monitor how many of these emergencies happen and how we can improve with the data that we collect these emergencies.
Are you moving into predictive use of data where you can speculate this might be coming? Cecilia?
Yes, those are the pilots we are working with. Yeah, we are starting to pilot in some IA initiatives, trying to modeling and deep dive a little bit in the machine learning and the models world. So we are in that process right now. And regarding the numbers you were mentioning before, it might look like we are in a small organization, but we are not. Only in Spain, we are more than 12,000 employees, just employees. We are moving more than 200,000 volunteers, and we are able to provide help to more than 11 million people per year, only in Spain. So that's a lot of things, and it can be just simple, like what I was telling before, is just call me every day because I need help, because I need to talk to somebody, and we provide this support. Or bigger things, or bigger in the sense of survival things, like the emergencies, life risk emergencies. So those are the numbers.
Yeah, that's, again, very, very impressive. I can tell from all three of you, actually, you're very passionate about the work that you're doing. Can you describe that a little for me? I mean, what gives you the most job satisfaction, especially with this interesting marriage of using data in your work and with so many clients? Maybe we'll start with Raquel.
Well, for me, it's, I don't know, being able to be there and doing things for people, I think is one of the the best things that this job provide, because, and it joins because you could do a lot of things, you could do a lot of things to help people, but using the knowledge or what I've learned during all these years in data, and knowing that data can make people being better, that helps a lot to continue to try to look for new things, to try to drive Cecilia crazy sometimes, So all these things, all the things that we know that we can achieve with data, help us in the day-to-day, to improve and to try to be better and try to get to the most people possible.
Wonderful. Cecilia?
Yes, for me, I've been involved in the data world for my whole professional career, a lot of years now. And before, I was in the private business, in the private sector, and mainly in the goods business. And behind that data, there were goods, there were things. Behind this data, it's people. And I think for me, it's one of the most important things, that analyzing that data, I can return to that people. I can give to that people something in return. And that something in return is not making profit with it's not make profit with the data, but is trying to improve their lives, and to improve and to to improve their vulnerabilities. So the fact that behind that data is people, I think is one of the things that encourage me every day to come to work and to keep on doing things.
No, that's beautiful. And Amanda, locally.
Yeah, I mean, it's very similar along the same lines. It's very easy to get caught up when you have quality in your title, in quality assurance, especially the huge amounts of data that public health has been collecting. There's always quality assurance issues, and it's very easy to get caught up in just spending all your time correcting data. And it's what I care a lot about is to make sure that we are asking bigger questions about how what we're doing is impacting people, making sure that we're collecting data that's actually useful and will tell us what it is that people need, what they want, and get at what matters to them.
Right. So we're actually getting quite close to the time. I'm going to just start our promo for the second cup. And this is actually a time we promote a bit about what's happening. And what's coming up, one thing I want to make note of for folks is September 15th and 16th, the Canadian Open Data Society's conference is coming up, and early bird registrations are open right now. So you want to check the Canadian Open Data Society website. We also are planning another webinar in August and another cafe in September. Personnel is still yet to be confirmed, so I can't give you too much more information on that. And quickly, I didn't see any questions coming through. Does anybody have anything from our audience that they might want to ask just before we close off from what you've heard today? No pressure on the outside folks. All righty then. Well, I'd like to thank you all for participating, and it was really wonderful to talk to you. I think it's great when we can see what else is going on beside our little region. And Go Open Data is an Ontario regional association, but we definitely want to collaborate and really appreciate knowing what's going on, not just in Canada, but even beyond Canada, of course. So to hear what you're doing in Spain, it sounds amazing. And also wonderful that you really are integrating data. You often hear that data is the new oil, if you like. And I think from what you've described, obviously your services are better with data than without data. And no longer do you have to just use paper, right? You're really crunching numbers and getting into the technology as well. So I think you can never predict, as we said, when a disaster will hit, right? So it's good to know there's agencies such as yours, and also the fact that you're collaborating beyond Spain and bringing some of your experiences, and I'm sure it works in reverse. And you mentioned there's some Canadian connections as well, and Amanda, locally too. I think what we've seen in COVID is just so much attention obviously having to be put into this, and living through it. I can't speak for what happened in Spain, but our experience here in Ontario was certainly, it's a long-term thing that we really had to knuckle down and deal with. And maybe just for the benefit of our audience, you might, Raquel or Cecilia, just describe, was it similar in Spain, where it was just, again, everybody was focused on resolving this, and the work that you might have had to do was altered because of that?
Yeah, well, in my case, I was focused on COVID operation last year from March to June, and we moved everything aside, and the response was only on the only focus and the only job that we had, and trying to explain that data and that activities that we were doing to the different audience that we have. So for us, yes, it was full-time job all days during that time. And then after it was a little better, it improved a little. Since then, we were able to do other activities that we have in the pipeline. But nevertheless, all the communities and all the local branches keep on working with activities regarding COVID. and we are still Spanish Red Cross is still working there, and the team of Cecilia is updating the open data so that information is in real time available to the population
Daily.
Daily, right? Well, I mean, again, it's not funny. It's true how similar the world can be, especially when we're looking at something that is a worldwide pandemic, such as COVID was. So in that case, we do share a lot in common, I think, in how we are struggling to fight this and deal with vaccinations and prevention, and it's not over yet. So perhaps we'll have to continue this in the future when it's over and we can look at some of your conclusions and see where they sit. And again, it's been a pleasure. It went by really fast. I'm sure there's a lot more that we could talk about. So I would invite you back at some points in the future for another cafe. And I really appreciate you attending. And I guess it's around 6, almost 7 o'clock, I think, your time, right? 7 p.m. That is.
Yeah.
So it's a long work day for you, no doubt. So once again, thank you. And thank you, Amanda, for attending with us. Let me just get the final slide up there. Yes, as I always say, make sure that you're good to each other. And we'll see you again, I hope, for another cafe and another webinar coming up in the future. Enjoy the rest of your day. Just some final credits before we wrap up. We'll see you next time. Bye for now.